For Edmonton Strathcona, Leader of the ND Opposition.
Thank you, Mr. Speaker. 3 years ago, the Health Quality Council of Alberta reported that constant reorganization of our healthcare system causes chaos for patients and frontline workers and recommended stability. So if we've had boards, then we had regions, then we had bigger regions, then we had one big region, then we had a central board, then they fired the board, then they had a deputy minister, then a CEO, and now they're hiring the board again. And now they're re-decentralizing the government's centralized healthcare system. So my question is to the Premier. Why should anyone trust your government on yet another healthcare reorganization?
Mr. Speaker, I thank the honourable member for the question. All we're doing was setting up an organizational structure to allow Alberta Health Services to operate more effectively. This is not as much a reorganization as an operating model, which allow them to operate more effectively, deliver services to rural areas in a more efficient manner, and deal better with the residents of our province.
For a supplemental, honourable member.
Sounds to me like a re-disorganization, Mr. Speaker, but today's report on rural health care makes it clear that health care in rural areas isn't serving the interests of Albertans. It's unacceptable for people to have to drive 600 kilometres for a 5-minute consultation. It's unacceptable that people are dying because dialysis is too far away. It's unacceptable that rural communities are losing people and business because they can't keep a family doctor. So again, to the Premier, will you admit that your government's original centralization was and is an abject failure for the people of this province?
Mr. Speaker, I'd like to say that this country, many jurisdictions are looking to go to a centralized healthcare system. But centralization doesn't mean just one particular entity. It means finding a best operating model, which is what we're putting in place. We're trying to make sure we relate to our communities to give them the kind of health services they all desire, and that's what we'll be doing.
Supplemental, honourable member.
Mr. Speaker, this report outlines hardship and dangerously low or completely absent basic health care services outside of Edmonton and Calgary. Whether it's obstetric care, mental health, dialysis, seniors care, in almost every way, this government has let down rural Alberta. The problem is this: almost every meaningful recommendation in that report costs more money. So, how can Albertans trust this government to provide safe health care in a time of fiscal restraint when they neglected and abandoned rural Alberta health care when times were good?
Honourable Minister.
Thank you, Mr. Speaker. We believe a new, more decentralized system will allow it to be a better system, less costly, with greater care. We think the new system we're putting in place will give Albertans a better opportunity to have access to care, and we'll continue to do that, Mr. Speaker.
Thank you. The honourable member for Ridley Rocky Mountain House, followed by